This is Dr. Craig Zeman. We're going to do an arthroscopy on this gentleman. He has autolysis of the distal end of the clavicle and has been having pain. So he's been injected, taken oral steroids, anti-inflammatory medications. We treated him for about 6 months conservatively. This guy's got no biceps. What a trip, man. The guy has no biceps tendon attachment. There you go. He's got no history of that. And it must be in the groove, because on the MRI, look at that, he doesn't even have a hole where it went. You have the arthric hair. So sometimes when I get this tissue down, then you keep shaving it, and it'll just keep coming up, so I'll do a little cautery. Kind of shrinks it up. Just stay away from the cartilage. Oh, see, he's got this labral tearing down in here. We'll take a look in the back. So you can see where you had that little tearing. We just kind of clean that up a little bit. So you can see his bursitis isn't too bad. But we're still going to have to do a little bursectomy and probably take a little bit of his zirconia just to get access to the AC joint knife. So we'll just do this bursectomy. So as you can see here, he has a pretty good hook, so we are going to do an acromioplasty burr, please. Try to keep my incisions small there before I don't have water leaking out quite as bad. I wouldn't want to give you the impression that there's no water leaking. So over here, see, this is where normally you'd see the AC joint right in there, but it's gone, and that's autolysis, and I think it's this tissue here that's painful. Okay, we'll get to that in a second, but I wanted to show it to you while I was seeing it. You can normally you'll just see the butt end of the AC joint right in there. You see, it's just nothing but scar tissue. See that? And for whatever reason, once you get rid of that scar tissue, their pain goes away. And if you look, I make my portal as pretty low. I think that, I know when I first started, there's always a tendency to kind of go right where the groove is. You always kind of want to go below the groove. Then you just try to save this, almost what I call the periosteum. I think it is a periosteum actually, or the thick tissue. And now you can see we're starting to get this, be rid of the hook. Okay, and there you have it, decompression. So somewhere right in there is the scarred up AC joint, arthric hair. And then see here, see this big void right here. See that? And then there's that junk right there, see? See that scar tissue? And that's what's causing the inflammation in there from his autolysis. It hurts pretty bad. And this is a pretty successful operation. So I clean out everything as best you can. You want to make sure you go back posterior, see how you can smooth out a little bit. So Dr. Bacon's saying that he's telling us he knows this is painful because the guy's heart rate went way up once we started hitting this spot, so that's always a good sign too. And then, you heard me call it before, poo corner. It always bleeds. It helps if you get your triangulation skills down. Sometimes it'll bleed so much that you really got to go by feel because you can't see. That's what's nice about these Arthrocare units. You can kind of do Bovie by proxy, I call it. Just get it in the area. And you can just see there's just no nothing that makes it even look like a AC joint. Now I'm going to take a burr now. Now you can see here. I use the ablation on the bone to stop the bleeding. Oh, we got a pituitary. It's another thing I've found useful on my AC joint excisions is sometimes you'll get this osteophyte down here and it's really hard to burr away. So it's nice to have a pituitary in the room. And then you can just bite it out of there. And you know you're starting to get probably far enough once you start seeing the AC joint looking kind of flat. Like I told you before, we got this little spot here. Smooth it out a little bit. And then the last thing I do, because I think we're done, is we want at least 2 breaths of the shaver. So 1, 2, 1, 2. Get a feeling that the AC joint's kind of leaning away from us, okay? So that's a good sign. Arthrocare. And there you have it. That's what Autolysis of the distal end of the clavicle looks like. You can see it's a fairly easy AC joint excision, but at least you got a sense of what it looks like when you get in there. You know, sometimes maybe, you know, you could miss it on x-ray, and when you're doing the patient, realize what's going on. So, hope you enjoyed the video.
When they beat upon a broken guitar in all the streets, the wicked tropical charms, the embassies, lying hideous shards where tourists snore in the